Let's talk a little bit about clinical trials, because even in our conversation about things like personalized medicine, the topic of clinical trials always comes up. How do clinical trials impact your work?
Yeah, so they become basically a window of opportunity for those who may not be able to have access to some of the more commonly utilized medications. Again, your resmetiroms, your injectable drugs, or for patients who have not been able to tolerate these therapies, may have failed these therapies, and having that window of opportunity to screen them for a candidacy and eligibility is another tool that we can help facilitate and basically see who could enter. And again, this is how we develop the drugs that we have, the resmetiroms, the injectables, by clinical trials and getting patients to participate.
Hmm. And when it comes to patient participation in clinical trials, there tends to be an issue with when it comes to the range of people who participate in clinical trials. How are you navigating the challenge? Is it a challenge to get patients to participate in clinical trials?
So yes, I always like share the opportunities that are available when I encounter a patient who would potentially be a good candidate for some of these opportunities that we have at our center. We discuss what that would entail, the risks to the patient, if any. They're basically burdened from the perspective of being a participant. And again, the opportunity is always there. So even if someone is not interested on their first evaluation, we maintain our starting relationship. Again, we continue to monitor the response to kind of more, I would say, conventional or readily available therapies. And should that window present itself where maybe this is the right patient to go return to that clinical trial, we already have that standing relationship, and we can continue to discuss and represent it, and maybe have them be an enrollee and participant.
Mhm. Are there any common themes of pushback or apprehension that patients kind of bring up when you present clinical trials to them? What do you feel is maybe preventing patients from participating in clinical trials more?
Yeah, I think sometimes it's a lack of a fear of what does that mean? Am I the quote guinea pig for some new medication? And that those are all very real concerns. It's a scary thing to be able to be enrolled in something that you don't have day-to-day access to, that you may not know the outcomes or side effects of. For some patients, that's basically their one window of opportunity to be able to want to pursue therapy for their disease state. So and when they're ready, we can have that conversation, give them some insight into what this would entail, the screening process, their eligibility as well, to just make them comfortable with that decision and really leave it up to them entirely.
Mm. There has been some promising new work published in this field, which is interesting because I feel like there's not always a ton of really new information on MASH necessarily. So, talk to me a little bit about some of these new phase 2 and phase 3 trials that have come out and how you see it maybe potentially impacting your work somewhere down the line.
Yeah, so I would say at the moment the biggest highlight of note is the Essence and the recent FDA approval of semaglutide for MASH. Huge game changer, and kind of a landmark day in this field. We've already tried to know this is a wonderful drug for weight loss for type 2 diabetes as indications, and now to have the approval for MASH really changes the kind of the opportunities we have for patients coming through our clinics, and hopefully the approval pathway as well to treat those who are appropriate. I mean, it has proven fibrotic benefit, proven inflammation benefit, steatohepatitis benefit. Wonderful tool all around for us to use for patients who can meet and basically be great candidates for this drug.